Hello, everybody. Today, I'm going to talk about Plexus-specific quantification of fluid volume in diabetic macular edema. Diabetic retinopathy is the leading cause of vision loss in the working age population worldwide. Diabetic retinopathy causes vision loss due to two conditions, diabetic macular edema and proliferative diabetic retinopathy. In general, sicker retina suggests a worse visual acuity. Since OCT has been developed, an association between retinal thickness and the visual acuity was reported. However, retinal thickness demonstrated only weak to moderate correlations in patients with DME. This suggests that macular thickness alone may not be a good biomarker for visual acuity. A potential reason is that retinal thickness can vary substantially among normal individuals. Deep learning algorithms allow us to measure three-dimensional fluid volume, and the fluid volume could be an alternative biomarker that represents oxidative change directly. As you can see in the right image, the central macular fluid volume from the OCT angiographies can determine the diagnosis of diabetic macular edema, but the middle image shows the central subfoveal thickness was only 261 micron, and this was not met the DRCR criteria of DME. Using this algorithm, we have reported that an automated center macular fluid volume is a more precise diagnostic biomarker than CST for DME, especially in cases with retinal atrophy. However, the correlation coefficient between fluid volume and visual acuity was low. Correlation coefficient was negative 0.30, and this was almost the same as the correlation coefficient of central subfoveal thickness, negative 0.33. So do these results mean that fluid volume is not a promising biomarker? Previous studies reported two preferential sites of diabetic cystic change, the inner nuclear layer and outer plexiform layer. In INL consists of various cell bodies, and the disorganized retinal inner layer, the layer, is essential biomarker for visual acuity, suggesting increased inner fluid volume in the INL may have a more significant impact on visual acuity. To answer this hypothesis, we conducted the study to quantify the fluid volume in INL and OPL separately and assess the relationship to visual acuity. A cross-sectional study includes DR patients with DME. Deep learning-based algorithm detected fluids in INL and fluids in the OPL in 3x3mm OCT scans. This slide shows how we assess the three-dimensional fluid volume. We used the volumetric OCT scans. Based on OCT segmentation, the algorithm automatically detected Plexus-specific fluids. As you can see in the left image and the middle image, we define the inner fluid volume as the fluids between the upper and the bottom of the border of INL, and the outer fluid volume as the fluids between the bottom border of INL and the ellipsoid zone line. And subretinal fluids as defined as the fluids between ellipsoid zone line and the retinal pigmental epithelium. All 304 OCT images are purged and output as volume rendering OCTA. As you can see, three-dimensional fluids are visualized. These are representative cases. As you can see, fluid accumulation varies among cases. Case 1 and case 2 have small inner fluid volume and large outer fluid volume. However, case 3 has greater inner fluid volume than outer fluid volume, and case 3 also have subretinal fluid. In this cross-sectional study, a total of each of 125 patients were included from 2 prospective OCTA studies. Inner fluid volume was observed in 109 eyes. Outer fluid volume was observed in 124 eyes, but the subretinal fluid was only observed in 29 eyes. Since the subretinal fluid is a potential biomarker for 1-year vision outcome, but not for baseline visual acuity, we only assessed inner and outer fluid volume in this study. This slide shows a patient characteristic. The mean age was 60.5 years old and half were women. Here are the DR stages. So these are the results of fluid volume in each plexus and the total macular fluid volume, which was the sum of inner fluid volume and outer fluid volume. As you can see in the left graph, the outer fluid volume was significantly greater than the inner fluid volume. If you look at the table on the right that shows the mean value of fluid volumes, we can see that about 80% of macular fluid volume is made up of outer fluid volume. What is the relationship between fluid volume and vision? As we expected, there is a clear negative correlation between inner fluid volume and visual acuity. And there was also weak but significant correlation between outer fluid volume and visual acuity. Of course, we also found a significant relationship between central subfoveal thickness and visual acuity. To compare multiple relationship, we performed a multivariate analysis. The results showed that inner fluid volume was the only factor correlated with visual acuity with a standardized correlation coefficient of negative 0.51. In addition, we performed a subgroup analysis to consider the possibility that previous treatment, especially focal macular photocoagulation, might affect the results. The relationship between inner fluid volume and visual acuity was consistent in 33 treatment-naive cases and 93 cases who had never received macular laser treatment, suggesting inner fluid volume may be a consistent and robust biomarker. The limitation of this study is, since this is a cross-sectional study, it is necessary to examine the changes in fluid volume and visual acuity over time. And also, this study did not evaluate retinal tissue degeneration or capillary attenuations. These factors may affect visual acuity. So we would like to study these factors in the future. In conclusion, the increased inner fluid volume correlated with decreased visual acuity, suggesting that the increased inner fluid volume may represent the progression of retinal degeneration. The results of univariate and multivariate analysis and subgroup analysis suggest inner fluid volume may be a consistent and robust biomarker. Therefore, we believe that it will be an essential biomarker to evaluate inner fluid volume in DME practice. I would like to thank all of the members of the core lab.